It's kind of wild when you think about it, but like almost 25% of skin tumors in dogs, they're mast cell tumors. It's a lot, right? When you think about how many of us have dogs.
Yeah, it's definitely something we need to be aware of as dog owners. And that's what we're doing today, really diving into this world of canine oncology, specifically mast cell tumors, those MCTs everyone's talking about, and then lymphoma too. Both of these, unfortunately, they're not super uncommon in dogs. And, well, the good news is that veterinary oncology is a field that's always learning new things, always improving.
Okay, so let's jump right in. First up, mast cell tumors. The research you sent mentioned something called FNAC. What is that exactly? How does that work for diagnosing?
Basically, FNAC, it stands for fine needle aspiration and cytology. Which, yeah, I know it sounds kind of complicated when you say it all out like that, but honestly, it's pretty straightforward. It's basically just using a really thin needle to take a small sample, just a few cells, from the tumor. And then those cells are examined under a microscope. The thing is, mast cell tumor cells, they have a very specific look to them, so usually we can get a pretty accurate diagnosis.
So it's like a little sneak peek to see what's happening at the cellular level. That's really cool. I also read that, even when you have that information, sometimes there's not always a clear consensus on how to stage those tumors.
Yeah, you're right. There can definitely be some subjectivity when we're talking about staging MCTs. Traditionally, it uses grades 1 through 3, with 3 being the most aggressive, obviously. But there's been a shift towards a newer system that a lot of people are calling the Kiopel system. And this system kind of tries to simplify things, so it just classifies tumors as low grade or high grade. That's it, just 2. And the goal with this is to get a more accurate prediction of how that specific tumor will behave. And that's important because it helps us make better decisions about treatment. And of course, that also gives owners a better idea of what they might be facing.
So it sounds like even with those two systems, it's not always a simple answer. You still kind of have to do some detective work.
Oh, absolutely.
Yeah.
Because every single dog, every tumor, it's unique. So it really is about looking at, every piece of the puzzle.
And this is where it gets interesting, right? Some of the research mentioned using cytology, like what we were talking about, to actually predict how aggressive a tumor is. And that's like before doing a biopsy even, right?
You're exactly right.
Yeah.
And this is really cool, actually. We're basically looking for clues within the cells. Things like how quickly are those cells dividing, if there are any weird structures, the shape and size of them, all of that can give us information.
Hmm.
Of course, we still rely a lot on histopathology, so examining an actual tissue sample. But this cytology approach could be huge, less invasive, and we get faster results.
Wow, that's amazing. So much we can learn just from looking at cells.
Yeah.
Amazing. Okay, but once we have the diagnosis, then what? I mean, then we have to think about treatment, right? And one thing that came up in the research was using prednisone, but before surgery. What's the thinking behind that?
So prednisone, it's a corticosteroid. And one thing it's really good at is shrinking tumors. And that includes MCTs. So on the surface, it seems to make sense, right? Like shrink the tumor, then it's easier to remove. But there's a catch,
Oh, there's always a catch, isn't there?
right? So prednisone, it can mask the true edges, the margins of the tumor. What I mean is it might look smaller than it really is, and when that happens, you might not be able to remove all of it. And obviously, we don't want that because if it's not completely removed, there's a higher chance of it coming back.
So it's like, I don't know, trying to get rid of a weed in your garden. You pull out what you can see, but there are still roots underneath. You think you got it all, but nope, it'll just grow right back.
That's such a good analogy because it really does highlight why this is such a tough decision. I was reading this one study where they found that, yeah, the prednisone did shrink the tumors, but it didn't actually lower the chances of them coming back if the removal wasn't complete. So it might make things seem better, on the surface, but it's not necessarily changing what's actually happening with the tumor.
Wow. It's kind of like a magic trick, making it look like it's gone when it's not really. And that's exactly why we need to be talking to our vets, right? Open communication is so important. Weigh the options, pros and cons, and figure out the best plan for that specific dog. Because every dog is different. Speaking of which, some breeds are more likely to get MCTs than others, right? So is there anything we can do to prevent these tumors in the first place?
Well, that is a question that a lot of researchers are trying to figure out right now.
Mm-hmm.
One thought is that chronic skin inflammation might be contributing, especially because we see a lot of dogs that have MCTs. They also have allergies, so there's that connection. So that's why there's been some buzz about omega-3 fatty acids
Yeah.
because of their anti-inflammatory properties. And there's even some really new research looking at immunotherapies. But, and I have to emphasize this, the research is all still very new. We need more data before we can say for sure if any of this is really going to prevent MCTs.
So it sounds like some promising possibilities, but nothing definitive just yet. Which makes sense. It takes time to do the research and get the answers. Okay, so switching gears slightly, we were talking about mast cell tumors, and you mentioned subcutaneous mast cell tumors. So the ones that are actually below the skin. They're
Oh,
different, right? What's
yeah.
different about those?
They're not as common. I mean, compared to the ones on the skin, we see these a lot less. And generally speaking, they don't seem to be as aggressive. Actually, there was this study, it looked at over 300 dogs with subcutaneous MCTs. And even in cases where the tumor couldn't be completely removed with surgery, and we already talked about why that's important even then, the survival rate was surprisingly high. It seems like with these, they're not as likely to spread.
Well, that's good to hear. A bit of good news, right? Speaking of good news, I have to ask about Stelfonta. I'm sure you've heard of this. It seems like everyone's talking about it. What's the deal with this drug?
Yeah, Stelfonta, it's also known as Tigelinol Tiglet. It's actually a really interesting new medication for MCTs. The way it works is pretty cool. It's injected directly into the tumor, and basically it cuts off the tumor's blood supply, so it basically dies from the inside out.
Wow, so it starves the tumor.
Exactly. And the amazing part, it not only kills the tumor cells, but it actually seems to help the surrounding tissue to heal better and faster.
So it's like a double whammy then.
Mm.
That's amazing. What kind of success rate does it have?
Well, in clinical trials, Stelfonta, it's been really impressive. They've seen response rates, meaning the tumor completely disappears, as high as 79.7%. And that's after only one injection. Even better. A lot of dogs, they stay tumor-free for at least a year, sometimes longer, after treatment. So yeah, it's definitely a promising new tool, and it could really make a big difference for dogs with MCTs.
This is really groundbreaking stuff. It sounds like Stelfonta has the potential to really change things for the better.
I'm optimistic for sure.
That was a great discussion about mast cell tumors. We covered so much, but we have another big topic for today, lymphoma. What can you tell us about this one?
So canine lymphoma, it's a cancer that impacts the lymphatic system. And, well, the lymphatic system is really important as a key part of the immune system. And lymphoma, it can show up in a lot of different ways and impact a lot of different areas of the body. Lymph nodes, of course, and then spleen, liver, bone marrow even.
And something that really stood out to me in the research is that vets are looking at lymphoma differently now, right? It's not just one disease. It seems like there are lots of variations. This word, phenotyping, keeps coming up. Why is that so important when we're talking about lymphoma?
It's a good question. Lymphoma, well, it's not as simple as it seems. There are all these subtypes, and they behave differently, and they respond to treatment differently. Phenotyping, what that does is it allows us to really figure out the specifics of the lymphoma cells. We get a much clearer picture, and that helps us to give a much more accurate and personalized diagnosis. It really is, like we're finding out the lymphoma's secrets.
That's a great way to put it. So how does phenotyping actually work? I mean, what are they looking at specifically?
There are a few ways to do it, but I guess the main thing is we want to know if we're dealing with B cells or T cells, because they're both white blood cells, but they do different things in the immune system. And there are a couple of ways to figure that out. We can do special stains on the biopsy samples, or sometimes we'll do something called flow cytometry, which is basically this really precise way to analyze cells.
And why does it matter? I mean, why do we care if it's B cell or T cell? Does it change how you treat it?
It can, yeah. We're learning that dogs with T-cell lymphoma, especially a specific type T-cell lymphoblastic lymphoma, they just don't respond as well to some of the chemo drugs that work great for B-cell lymphoma. There was this one study, it found that dogs with that type of lymphoma, the T-cell lymphoblastic, they didn't do as well on a drug called doxorubicin. It's a pretty common chemo drug, but it just wasn't as effective for them compared to the dogs with B-cell lymphoma.
So it's almost like even though they both have lymphoma, it's two different diseases.
Yeah, exactly. You said it.
Yeah.
And that's why this whole phenotyping thing is so important. Because if we know what we're dealing with, really know, then we can tailor the treatment, give that dog the very best chance.
That makes a lot of sense. Now, I also read about something called canine indolent lymphoma. Is there hope with this type? It seemed like maybe it's not as scary.
You're right, it's not as scary. Indolent lymphoma is definitely on the less aggressive side of things. Usually what we see is the lymph nodes, they'll be enlarged, but they're slow growing. And it's different, right? Because other types of lymphoma, they spread really fast and the dog gets really sick really fast. But indolent lymphoma, it's like it's taking its time.
So it's more manageable, like maybe more like a chronic condition, not this big scary thing.
A lot of times, yeah. And the really cool thing is if we catch it early, sometimes just surgery, just removing that lymph node, that's all it takes. We don't even need chemo. But I know I sound like a broken record, but early detection is key.
I can imagine that's a huge relief for owners, to know that there are cases where it's not this huge, intense treatment plan. Speaking of treatment, I want to hear about those cutting-edge treatments and diagnostics you mentioned. What's new in the world of canine lymphoma?
It's honestly a really exciting time to be in this field. We're learning so much, and there's so much happening. One really promising drug, it's called Laverdia CA-1. You might also see it called Vertimexer.
Oh, yeah, Laverdia CA-1, I remember that one. What makes it so special? How is it different from other things that are used to treat lymphoma?
So it works differently than a lot of the chemo drugs we've used in the past. It's part of this group of drugs called selective inhibitors of nuclear export. We call them SIN inhibitors for short.
Okay, that sounds intense, but like in simple terms, what do they do? How do they work?
Okay, so imagine this. Cancer cells, right? They need certain proteins to be cancer cells to survive, and they have to move those proteins around. What SIN inhibitors do is they basically block the exits. So those important proteins, they can't get where they need to go. It's like we're cutting off their supply lines.
So you're basically starving the cancer from the inside.
Exactly. And the amazing thing is, Laverdia CA1, it looks like it might be helpful for a lot of different types of lymphoma, even ones that don't respond to other things. And this is big. It seems to work on both B-cell and T-cell lymphoma. And there have even been cases where it's helped dogs whose cancer came back after chemo.
Wow, that's incredible. But with new treatments like this, is there a concern that resistance could develop, like what we were talking about with prednisone, where it stops being as effective?
That's the million-dollar question.
Yeah.
And it's something we're all watching really closely. Here's the thing. Prednisone, it works by binding to these specific receptors in the body. And sometimes cancer cells figure out a way around it to become resistant. But Laverdia CA1, it doesn't work that way. It uses a different pathway, so it might be less likely to have those resistance issues.
So the cancer cells, they can't outsmart it as easily.
Hopefully not.
Yeah.
But like I said, it's still early days. We need more research to really understand the long-term effects and if resistance will become a problem. But so far, things are looking good.
It really is incredible how much research is being done in this field. And it feels like all the time there's something new and groundbreaking. And when we're talking about exciting new technology, we have to talk about liquid biopsies. That's a term we're hearing everywhere, not just in veterinary medicine.
I know, right? Like liquid biopsies are the future. And honestly, they are changing everything about how we detect and monitor cancer, not just in dogs, in humans too. I mean, think about it. In the past, we always had to rely on tissue biopsies. So actually cutting out a piece of the tumor, which I don't have to tell you, it's invasive, it requires anesthesia. And even then, sometimes you don't get all the information you need.
So liquid biopsies, they're kind of like the superheroes of cancer detection.
I like that. That's a good way to put it. They're way less invasive, usually just a blood test, that's it. And those tests, they're getting so good. They can analyze these things called biomarkers, things like tumor DNA that's floating around in the blood, or cells that the tumor sheds. And all of that, it can tell us so much. Like what type of cancer is it? How aggressive is it? Even how well it'll respond to certain treatments.
It's crazy. You can get so much information from just a blood sample.
It really is incredible.
Do you have any examples of specific liquid biopsy tests that are being used in dogs, like right now?
There are, yeah. And one you might have heard of is OncoK9.
OncoK9. I was hoping you'd say that one.
It's really remarkable, honestly. OncoK9, it uses this advanced genomic analysis. So it's looking at the DNA, right? And it can find even the smallest amount of cancer DNA in the blood. And get this, it can detect like 30 different types of cancer.
Yeah.
And here's the best part. It can often detect cancer really early.
Yeah.
Like way before the dog is showing any signs of being sick, even before you can feel a tumor.
So you're talking about catching cancer before it even has a chance to really take hold.
Exactly. Early detection, that's what it's all about, right? Because then we have more options and the outcome is more likely to be good.
All of this is just amazing. We've talked about mast cell tumors, lymphoma, these amazing new treatments. But with all of this new technology, these new possibilities, I have to ask about the ethical side of things. What are some of the ethical things we need to be thinking about as all of this moves forward?
That is such an important question. Because you're right, with all this incredible progress, we always have to be thinking about the ethics. And I think one of the biggest things is, we have to balance lifespan with quality of life. We have all these powerful treatments now, but they can have side effects, right? So we had to ask ourselves, are we doing what's right for the dog? Are we just extending their life, even if they're not feeling well? We owe it to them to make sure they're comfortable, that they're happy. That has to come first.
It's not about quantity, it's about quality.
Yes, exactly. And another thing to think about is the cost. I mean, let's be real. A lot of these new treatments, they're expensive, and not everyone can afford them. We have to be sensitive to that, and we have to make sure everyone has access to the care they need.
Absolutely. So it's about having those honest conversations with owners, talk about what's possible, what makes sense for their situation.
100%. And we have to be realistic, too. As amazing as all this is, cancer is still cancer. There are no guarantees. And sometimes the kindest, most loving thing we can do for our dogs is to just focus on keeping them comfortable, make sure they're not in any pain, even if we know we can't cure them.
That's a really good point. We have to balance hope with being honest. Always do what's best for our dogs.
I love that.
Yeah.
Hope and honesty.
This deep dive has been so informative. We've learned so much. But we're not done yet, are we? Because there's one more big question we need to answer. Is there anything we can do to prevent cancer in our dogs?
The question everyone wants the answer to, right? And while there are no guarantees, of course, there are definitely things we could do to help our dogs live longer, healthier lives. But we'll save that for part 3.
Okay, so we're back. And I have to admit, I'm really curious about this. After everything we've learned, is there anything we can actually do to prevent cancer in our dogs?
I know, right? It's like the holy grail of dog ownership. And, well, I can't tell you how to wrap your dog in bubble wrap, but I can definitely tell you there are things we can do that, well, they kind of stack the odds in their favor.
I like that, stacking the odds. So what are some of those things, those power moves?
It all starts with the basics, right?
Yeah.
And that means regular vet visits. I know, you've heard it before.
It's true. It's like the #1 rule of having a dog, but it's important. So I'm glad you're saying it.
It's one of those things, you hear it so much, you tune it out. But it's true. Those checkups are so important. It's like preventative maintenance. And it means we can catch things early on when they're usually easier to deal with.
And that includes cancer, right?
Absolutely. Early detection with cancer is huge. The sooner we know what we're dealing with, the more options we have.
Okay, so how often are we talking? Once a year. Is that enough?
For most adult dogs, yeah, once a year is a good starting point. But, and this is important, your vet might recommend coming in more often depending on the dog. Like how old are they, what breed are they, any health issues, things like that.
That makes sense. So we're going to the vet, we're having those conversations. What else should we be talking about? I mean, specifically about cancer prevention.
Be sure to tell them everything, right? Like their full health history, if there's any family history of cancer, that kind of thing.
Oh, that's interesting. So just like with people, knowing if there's a genetic component can be really helpful.
Exactly. And if there's anything specific to their breed, like are they prone to any certain types of cancer, knowing that can make a big difference.
Makes sense. Okay, so we're having those conversations. We're going for checkups. What can we do at home?
This one you've probably heard before too. Keeping them at a healthy weight. So important.
Just like with humans, right? It always comes back to that.
It's true. Being overweight, it's a risk factor for so many things, and that includes cancer.
No more second breakfast for my pup, then. Okay, but seriously, what are your best tips for keeping our dogs trim and healthy?
This is going to sound familiar too, but a good diet and exercise. Those two, they're the magic combination.
Like peanut butter and jelly.
Right. They just go together. When it comes to food, I always tell people, talk to your vet. Because the best food for your dog, it depends, right? How old are they? How active are they? What breed are they? But also, and this is something a lot of people forget, portion control is key. I know, those puppy dog eyes are tough to resist. But overfeeding, it's not doing them any favors.
Okay, noted. No more spoiling my dog with too many treats. I'll try to be strong. And exercise. What are we thinking? How much do they need?
It depends. Again, right. Every dog is different.
Yeah.
But generally speaking, a good goal is at least a half hour, so like 30 minutes, of moderate intensity exercise. And this is important. We're not talking about just a slow walk around the block. They need to be moving, get that heart rate up. So think brisk walks, playing fetch, maybe even some agility training.
We want our dogs to be living their best lives. That's what I'm hearing.
Exactly.
Yeah.
And it's not just about their physical health either. Exercise is good for stress. And just like with people, too much stress, it's not good for their health overall.
Okay, this is all making so much sense. Vet visits, watching their weight, keeping them active. Anything else?
Oh yeah, one more big one. Spaying or neutering.
I always knew it was important, but to be honest, I never really understood the connection to cancer.
It makes a big difference. I mean, for female dogs, spaying, it completely eliminates the risk of uterine and ovarian cancer. And it makes a huge difference for mammary cancer too, especially if it's done before their first heat cycle.
Wow, I had no idea it was that significant.
It really is. And for the boys, neutering, it takes away the risk of testicular cancer. And it can help reduce the risk of prostate problems, which sometimes those can turn into cancer.
This has been so helpful. I feel like I actually understand now, like, what I can do to make good choices for my dog.
That's what it's all about.
But, and I have to ask, even if we do all these things right, sometimes cancer still happens.
You're right. It's true. But here's the thing. A cancer diagnosis, it's not the end of the world. It's not an automatic death sentence. We're lucky, really. We have so many options now that we didn't have before.
Yeah.
We've got incredible treatments. We can keep them comfortable if that's the best option. And we're always learning more.
There's always hope.
Always. And never forget, love and support, those things make a big difference too. Our dogs, they give us so much love. And sometimes the best thing we could do for them is just be there for them, no matter what.
So well said. This entire deep dive has been incredible. We've covered so much. It's kind of amazing. We talked about mast cell tumors, lymphoma, all those new treatments that are changing everything. We even got into the importance of those everyday things we can do, the preventative care. And through it all, I think the message of hope really came through.
It's been great. So glad we could do this.
And on that note, this has been the deep dive. Remember, knowledge is power, so keep learning, stay informed, and most importantly, love those furry friends.